Welcome to the CNSA Global Health Committee podcast series. Throughout the series, we will be interviewing different nursing leaders to provide listeners with a glimpse into current, local, and international global health initiatives. We hope to provide students with a greater understanding of global health and to inspire students to pursue paths that will enable them to become future leaders in global health. We hope you enjoy. Hello.
Hi,
Wendy. How are you today?
I'm fine, Katie.
Thank you for taking the time to talk to us today and share your experiences with me and our listeners. First off, can you tell us a little bit about your background in nursing and how long you've been a nurse for?
Okay. I've been a nurse for 32 years, if you can believe that.
Wow.
Yeah,
Awesome.
yeah. It's when I say that, it looks like a long time. I sort of came into nursing an unusual way. I wasn't one of those that wanted to be a nurse my whole life. I didn't even consider nursing. And when I graduated from high school, I didn't take the right courses to do anything in higher education, so I had to do some upgrading. But while I was waiting for that, I had a summer off, so an opportunity came up to join the military for the summer for full time, and so I thought that was a great idea because it's kind of fit with some of the outdoors things I like to do, because I got to go rappelling and whitewater rafting and all sorts of things like that. So I did that for the summer, and then come September, I went back to school to do my upgrading, but I stayed in the military part-time. And in the military, I was still doing things like learning to drive all the big trucks and doing some mechanics and that. And so when I had my upgrading finished, I came up here hoping to get into the mechanics program.
Okay.
But it was full. But I wanted to have something that led to a career. So the only other thing that was open was nursing.
Oh.
So I ended up in the nursing program. But I had learned a lot of first aid and everything in the military. But so I had never considered nursing until that time. And so then I went into the nursing program, and I did a 3-year diploma. And as soon as I graduated, I went to acute care, and first of all I worked on the maternity ward, so for a year. So, and then I kind of got a little bored. So then I wanted a full-time job because I was only casual there, and a job came up in rehab.
Okay.
And so I worked in rehab for a couple of years, and I kind of enjoyed that because I really liked seeing how, the little things, how you can motivate patients to do things for themselves and, not just go in and do things for them. And then again, boredom always seems to drive me. So when I thought I had learned everything there, then I looked for a transfer, and I went right from rehab into the critical care float pool. So I worked in ICU and emergency and the neuro ICU, and then I found that I was able to deal with everything except for head injuries. Really frightened me because you can't see what's happening. You actually have to think through that and look at trends and everything. So I decided to take a full-time job in the neuro unit, and that's where I got my CNA certification for neuroscience, which I've held now for like 25 years. So,
wow, wonderful.
And all the time I was doing this, and after the neuro unit, I went to the general ICU because they closed the neuro unit, and that's where my practice was. But then at the same time, I'm still doing the military, and the military was very interesting because I got to do things that I didn't normally do in my practice. So things like becoming an aerobac nurse, so being able to take patients in the air in fixed wing as well as rotary wing, and then we did a lot of training because when we started sending soldiers to Afghanistan, it was a different type of warfare there with IEDs and blast injuries, and things like that. So we had to upgrade all our medics before sending them there. So so we did a lot of scenario-based training, which kind of led me into where I am today. So teaching and working with simulation.
That's wonderful. And with the Aerovac nursing, you must have had to learn kind of the basics without the pumps and everything as well, right?
Yeah,
so
yeah.
learning all that kind of in a new, different way,
and
with the pressures and
yeah,
then the
learning
cockpits.
what pressure does at altitude, and knowing that whatever you pack is all you have to work with.
Right.
So if you don't think and pre-plan things, that you're up there and you're by yourself. So it's like I took all my patients in a C-130, which is like the back of a cargo plane. So I have them on stretchers, and they're 5 in a tier of 5. So if you have to give an antibiotic to the guy that's on the top, you're climbing up the stretchers to do that.
Oh, wow.
You don't have poles.
No.
I had one patient that was on a striker frame, which is somebody with a spinal injury that you actually have to turn in the air. Like we've had babies in incubators, and you have to know how to change them, because we have some liquid oxygen, right? So you have to be able to put that into a gaseous form, and remember how to do that and what order to do that. So we have a lot of checklists.
Yes,
I'm a fan of checklists.
Me as well.
So, yeah.
Oh, wonderful. So is that how you got involved in global health initially, was through the military?
I think so. It was, I think the military awoke this adventurous side of me, that I wanted to do that. It exposed me to a lot of different cultures, a lot of different ways of doing things. When you're thinking about Afghanistan and the military, and also when I was working in ICU, we tend to think just local, but I remember the first malaria patient coming to the ICU, and not knowing, you go through all the normal ways of thinking, well, what could this be, and it's not. And so you have to start thinking a little bit outside of that box.
Bigger, yeah.
And then all of a sudden you find out they have malaria. Or, why are they trying to extubate themselves? And you find out maybe there's worms or something in there,
Yeah.
And that comes back to your baseline data. What do you have about history? So everything always connects. It's just whether or not we recognize it.
Whether, we look at it in that perspective, for sure. And so is disaster preparedness one of the main areas you're involved in global health right now?
Well, I do a lot. Like, now that I'm an educator here, I've led international practicums. So I've been to Thailand, and Thailand was the first time when disaster medicine and disaster nursing and my military and everything all came together, because while I had students there was a coup.
Oh, wow.
And so the military was taking over, and so all of a sudden here I was in a situation where now there's tanks going down the road, and what do you do with that? How do you evacuate? Like, what about the people that are there? So that's what got my interest going. Since then, I've gone to Lesotho. I've taken clinical groups there for 8 years, and again, it was just a totally different culture, different norms, and that's what's led me to now working on my doctorate and specifically looking at global health and disaster preparedness and where the nurse fits in that. Because I think, you just have to listen to the news and what's happening in the world today to know that, we have to have a skill set that we can use for this, right?
Right.
So what is that skill set? What's the important thing? And how do we give that to our students? So that's the area that I'm going into.
Oh, wonderful. So what exactly do you think the role is then for nurses in disaster preparedness?
I think it depends on, it's a very big question.
Yeah.
Like if you look at it, what the basic definition of what a disaster is when the need overwhelms the resources that you have at hand. Right. So if you use that, every day you go into a hospital, you're facing a disaster, right? because you've got patients in the hallways and you don't have enough people. Yeah. So it's really hard. But I guess what I would say is it's a way of thinking, and our programs teach you how to think, right? And I know you hate me saying this, right? But we teach you all those foundational things like that pathophysiology and our pharmacology and our communication, and that being able to communicate, expect change. Right. Things are always going to change. You don't know it all. You'll forget more than you know. So knowing that and being inquisitive and always asking those questions and looking out for our clients to make sure that they have the best possible care. But then we also have to, in disaster preparedness, is to look at yourself. Like, are you prepared? Right. Like, do you have a plan?
Like, do you have a checklist on your fridge?
Yeah. Like, do you know, like, if you have children and you had to stay at the hospital because of a disaster, is there somebody that's going to pick that child up? What happens if your house is destroyed while you're at the hospital? What if you're at home and you have to go to the hospital because they need you there? Right. Are you going to leave, and what's going to happen with that? Right. So it's having that little personal situational awareness.
From there.
Yeah. Look at yourself. Are you prepared?
Yeah, and then going from there. Yeah. Totally. Do you think here in Kamloops we're prepared for a natural disaster?
Well, we've had many already.
How have we responded? Have we done well?
We have improved vastly.
Yeah.
Because like when we had the fires that were visible just out here, we have flooding that goes on all the time. I'll give you one example. Like looking at our municipal groups, such as the Emergency Social Services. They have a core group that they do training all the time with. So that because one of the most important things is knowing where people are, like knowing who is here, like is all the people accounted for, who's left. So there's a whole technique in doing that. So that we have a whole core bunch of people that are trained in that and do that on a yearly basis. So when we do have an emergency, it's quickly called out. Same with things like even animals, who thinks about animals, and what are you going to do if somebody brings in 4 horses?
Right.
Where are you going to put them? Yeah. Like, this is Kamloops. Like, people have horses, they have cattle. Like, where are you going to put them? So there is a plan for that.
Even people, like if we get a whole bunch of people coming in, where are we going to put them?
Where are you going to put them? What are their needs? What are some of the resources?
Are we going to be able to feed them? Get enough water for everyone?
Where are you going to do that?
Yeah.
Like where are your resources? So just that awareness, I think Kamloops is becoming more like better and better prepared all the time.
Wonderful, that's good.
Yay, that's good.
What do you think are some of the most pressing issues in global health right now, and areas you would like to see changed moving forward?
Oh.
I know, it's a huge question.
That would be really difficult to answer. I guess the most important thing is communication. Like, it's being able to ask those questions. It's having the knowledge of what's available. Like, I think every nurse needs to know the incident command situation and how to use that, how to access it. We have like the World Health Organization, and TV tells us all sorts of things about what's happening in the world. And we need to take that with a grain of salt, but it's always important to know what's going on, to know the background of that. When Ebola was happening, yes, it's happening in Africa, but when you look at the global mobility, that could have been in our front door too. So we always need to think about be aware of what's happening out there and how we would deal with it if it's here. And it's important to look at not only clinical things, but also political, social, economics, because everything is all interconnected.
Right, totally. Good answer. Next question. Would you recommend to nursing students to get involved in global health or any specific organizations you think that they should be involved in if they're interested in global health?
I think if you're interested in global health, is start with looking local. Like I talked about the emergency social services that most municipalities have. There is search and rescue programs. There is the Red Cross that do a lot. Like, get to know what they do on the local level, and then work your way up. I'll be assuming the presidency of the World Association of Disaster Emergency Medicine in April of 2017.
Wow.
In Toronto. So if anybody wants to come to that meeting in Toronto, that would be great.
Take me.
I'd love to see that. I can.
This is recorded. I got proof. Oh my goodness, congratulations.
Well, I did take 3 students to Cape Town last year. And so there is grants available to do that. So
wow, yeah, that would be a wonderful opportunity.
Well, and what happens there too is that you get the opportunity to meet world leaders, and you get the opportunity to meet people that are doing research into all over the world, and it's a good place to start to get mentorship. If you're interested in doing research like that. They can advise you to go different ways. There's also the World Health Organization has a lot of positions available too for students. So that's another option to do.
Yeah, that would be wonderful. Such great learning.
Yeah.
Last question for you. Do you have any advice for future nurses, ones that are involved in global health, besides the advice you've given already?
Well, I guess I would say never lose your enthusiasm. Remember that. I used to think that we are all connected. We're all human, and every emotion that we have is reflected in other people, but it might look different. So you really have to reflect on what you're seeing and judge. Don't judge it just on face value. Like, understand it. Like, ask the questions. It's everything you learn, everything changes. So never always be that lifelong learner. I know you've heard that many times before. Like, be a lifelong learner, but really do that. Really be inquisitive. Like, keep that knowledge with you and keep building on it and sometimes and learn to think. Like, you have to be able to think and put it together. Everything leads back to foundational things. So if you know your pathophysiology and you know how the body works, and then all of a sudden you're seeing something, it's affecting this, well, what happens there? You can start figuring things out. And so it makes your decision making a lot better.
Right. Instead of accepting things on whims, just really learning how to learn and being an active learner.
That's right.
I agree.
And ask the questions.
And ask the questions, because you never really know unless you ask, I guess.
Yeah, that's for sure.
Okay, well, thank you for taking the time to talk to us and share your experiences with me and all our listeners. We greatly appreciate having you here. You're a great leader for us in global health, and thank you so much.
Yeah, thank you for asking me.